Welcome to Medical Marijuana and Wellness. Today's topic is medical cannabis in Mississippi. What we plan to cover today is to talk about medical cannabis, what it is, what it does, and how it works, and then also how in Mississippi you can get a medical cannabis ID card and where you can get it and how you can get it. We'll be talking about live Q&A when we do this in person. First thing to understand is that the bottom line about medical cannabis is that it's safe. You cannot physically overdose from medical cannabis, and any of the negative side effects that you get from it can be easily counteracted. More importantly, you are in control. By using medical cannabis correctly, you're able to alleviate and to control any unexpected highs or uncontrollable feelings that you get, and more importantly, you'll not get addicted from using medical cannabis. You do not have to smoke it. There are other routes of administration or ways of taking it, and we'll be talking about that. And more importantly, the nice part about medical cannabis is it provides what they call the entourage effect. And what that means is all the different components of cannabis working together enhance their medical efficacy. Now, what does a medical patient look like in 2024? Well, we have this image of people using cannabis, Snoop Dogg and Willie Nelson, but in reality, the people that are using medical cannabis are seniors, they're veterans, they're athletes, they're professionals. What we're seeing is that medical cannabis is no longer taboo. In fact, it's becoming increasingly accepted, and it's being able to help people treat many of the health issues that they're facing today. It's something that really is new to us from the standpoint of being legal, but hasn't been new to us for a long time because it's been helping a lot of people. Now, as I mentioned earlier, there's been no fatal overdoses from the use of medical cannabis. This is very, very important. The World Health Organization, which monitors fatal overdoses, has found that no one has ever died from the use of medical or from recreational cannabis. In fact, the annual deaths from different substances shows that medical cannabis is safer than peanuts, safer than aspirin, and clearly safer than alcohol. So what's the big deal about cannabis? Well, we all know that we have a nervous system. That nervous system coordinates all the senses of our body, and we know if we have some sort of an issue or a problem, it tells the brain, Houston, we have a problem. What's interesting is what did Houston do with that? And when we started studying medical cannabis approximately 3 decades ago, what we found is that our body also has an endocannabinoid system. The endocannabinoid system is the part of our body that manages anxiety, pain, appetite, inflammation, basically all our immune system responses. The endocannabinoid system can be found in all mammals, and it really helps our body stay in something that's called homeostasis. And what do we mean by homeostasis? It means your body in balance. This is how your body helps you feel good, because your body produces naturally endocannabinoids that work with your body to be able to keep it in balance. Now, phytocannabinoids in the cannabis plant exactly mimic and are identical to the endocannabinoids our body produces. And in fact, it works with our different receptors, not only in our body and our nervous system, in our immune system, to really provide the healing properties that endocannabinoids provide for us in our bodies. Now, why would we need that? Because, for example, I'm a senior citizen, and as I get older, I don't produce as much or as quickly the endocannabinoids that are needed to really be able to help my body. So by being able to have phytocannabinoids in my body, in essence, we are storing the material that's needed for our body to keep us in homeostasis or keep us in balance and really help us be able to lead a better life. Cannabis is really a whole medicine cabinet. What we mean by that is cannabis has 450 medical properties. You can see on the right over here is a study that was done by Normal, and each of these little arrows that are over here indicate a research study that's been done on medical cannabis to show its efficacy. Now, I do want to point out in fact, all of those studies have been done outside the United States, because in the United States, cannabis is a Schedule I drug, and so therefore we haven't had a lot of research been done. What's interesting is we have 120 cannabinoids in the actual product itself, the cannabis plant itself. This is just 6 of them, but there's a lot of medical properties to the product, with cannabinoids being part of it and terpenes being another part of it. Working together, all of these endocannabinoids, these terpenes, and actually some flavonoids really enhance their healing properties. It's almost like 1 and 1 is 3. Now let's talk about a couple of well-known cannabinoids. One is THC. We've all heard about that. It's found in cannabis. And in fact, if you find a plant that has less than 0.3% THC, it's referred to as a hemp plant. That's actually the legal definition of hemp. It is psychoactive, and the reason it's psychoactive is because it targets the CB1 receptors, which are found in the brain and central nervous system. It's very important to use THC to address things like pain and to help in conditions where you have some mood conditions. For example, when you get from PTS and other anxieties that come from stress that we find in our lives. CBD is found in cannabis, and it's also in hemp. It's non-psychoactive, and what it does is it targets what they call the CB2 receptors in our peripheral organs and also in our immune system. Now, how does all this work together? Well, we talked about the entourage effect, and you can see the light blue receptors from the CB1 receptors. You can see the dark receptor for the CBD receptors. What's interesting is if you take a look at inflammation, you'll see that the different cannabinoids all produce different properties that help to be able to address things like inflammation, things like sleep, cancer, and also pain. This is where the cannabinoids working together provide a compound that can help address each of these different conditions, and that's why the different cannabinoids are very, very important, and why it's important to be able to pay attention to the entourage effect in your body. Now, how does this all work? Well, we know we have endocannabinoids. We produce that. They're actually produced by our brain. We know there's phytocannabinoids that are produced by the cannabis plant. And we've also heard of things where we call synthetics. This is a cannabis, or this is a mimic of a THC type product that is produced in a pharma lab. One of the most popular, or one of the well-known, is Marinol. Now, caution. If you're looking at a THC-only product, it is very dangerous. It should only be done under the guidance of a doctor. And in our particular discussion today, I'll talk about endocannabinoids and phytocannabinoids. I really don't want to address synthetic cannabinoids because, again, that's something that should be done under a doctor's care only. But using endocannabinoids and phytocannabinoids, our body then is able to address the CB1 and CB2 receptors, again, to be able to help us with our appetite, pain, sleep, pleasure sensation, immune system, mood, and memory. These phytocannabinoids and endocannabinoids are stored in the fatty acids of our body. When our brain says, Houston, we have a problem, the nervous system says we have a problem here. What's interesting is that it takes these fatty acids, turns them into long-chain fatty acids, and those endocannabinoids and phytocannabinoids are distributed through our bloodstream to the part of the body that needs to be put back into homeostasis. That's fundamentally how cannabis works. Now, we talked about CB1 and CBD and THC receptors. Addressing CB1, again, immune system and peripheral organs, and CB2 receptors, which is inflammation, immune response, and also our peripheral nervous system. But what we've also found out is that CBD acts as a supervitamin. It also addresses our blood flow, our breathing, our digestive system by working with the 5-HT serotonin receptors. It works with the 2A2 receptors to help with coronary circulation and inflammation. It helps regulate our pain with our VR1 receptors and also the GRP55 receptors to address blood pressure. So CBD is more than just addressing the endocannabinoid system. It's addressing our whole body. What are the common benefits from using cannabis? Well, this is a list of the different research documents that are available for the use of cannabis, and they've shown that cannabis can be effective. Now, these are more conditions that are approved in the state of Mississippi, but I just wanted to present them to you to let you know that cannabis has far-reaching effects to be able to help a lot of people with different conditions. How has cannabis evolved? Well, over the years, what we found is that there's cannabinoids, which we talked about, and there's also terpenes in the product. And when they work together, that's called a strain. Now, what's interesting is the last 5 years especially, a lot of the growers have been making products to address a particular situation, like sleep, like pain, like inflammation. And when they put those together and they target a particular outcome that they're trying to achieve, they call that a cultivar or a chemotype. So what's interesting is that our cannabis is evolving to a point where we're actually making products that address medical conditions and help you with those particular medical conditions. We're on the cusp of being able to really have a lot of those available and labeled that way in your local dispensary. Now, we talked about terpenes. Terpenes are extremely important. This is where the medical efficacy, the medical effectiveness of cannabis comes from. I'm not going to go through all of these. I'm just going to point out this chart will be available to you when you download this when you look at this from a YouTube video standpoint. You can see that it each has a particular medical property, whether that's helping to relieve stress and anxiety, whether it's helping with short-term memory, whether it's helping with mood, whether it's with sedative like myrcene. All of these have different medical properties, and that's where cannabis gets its medical effectiveness. I also want to point out that each of the terpenes is very sensitive to heat. Most of them you'll notice like low heat, low to medium heat, which means that if you heat them too hot, what's going to happen is you'll burn these off. And so we'll be talking about a little bit later when we talk about routes of administration. How do I use cannabis? Well, cannabis is what they call biphasic. And what biphasic means is that if you use it and you're using low amounts of it, what it does is it begins to address your particular issue and helps you to relieve that. However, you can't use, if you use too much of it, it'll actually bring back a lot of the discomfort, the nausea, and the effects that you're looking at. What's interesting is when you take a look at pharma products, they're all based on weight. In the case of medical cannabis, it's all based on you. Each person, every person's body is different. Just like alcohol and just like caffeine, if you have some people that you know can have one drink and they're done for the night, other people can drink the whole bottle and just getting started. Cannabis is much the same way. You really have to find out what your tolerance is to THC. And once you know what your tolerance is to THC, then you can dial it in and adjust the CBD to THC ratio that really helps you with your particular condition. What we mean by that is go low and go slow. Start with a low dose of the product that you're using. Increase it a little bit every day. You'll begin to feel a little more relief, a little more relief. Eventually, by listening to your body, listening to your body. Your body will tell you when cannabis is starting to work for you. You'll feel better. And it's amazing when it first happens, you go, wow, that's kind of cool. And a doctor cannot tell you exactly how much to take. It is all very individualized. Now, if you take a little bit too much, you'll begin to feel some uncomfortable feelings. You might feel a little heady. You might get anxious. The pain might be coming back if you're trying to address pain. So when you get to that point where you're taking a little bit too little more, back down to that dosing relief, and then increase the amount of CBD that you're using as a ratio. So, for example, instead of using a 1-to-1 product, 1 CBD and 1 THC, use a 2-to-1, 2 CBD to 1 THC, maybe a 3-to-1 or 4-to-1. I use a 4-to-1 product. My wife uses a 20-to-1 product, and we each get the relief that we need for our medical condition that we're trying to address. Now, we talked about the entourage effect. Very, very key, because cannabis brings all of its components, cannabinoids, terpenes, and flavonoids together. And what's interesting is things like CBD will lessen the psychoactive effect of THC. What that means is as you're dosing, if you get to a point that you may be taking a little bit too much CBD, too much THC, you can take some CBD by itself and it'll lessen the psychoactive effect and actually bring you back down. That's why a lot of people, when they're going through their dosing routines and just in general, have a bottle of CBD around just to be able to control any negative effects that you might get from using medical cannabis. Also, as I mentioned, the terpenes enhance the medical efficacy, and CBD and THC work together to really enhance their medical benefits. Now, how do we take medical cannabis? It's really 4 general ways. One is sublingual, where we actually put a drop underneath our tongue. It's absorbed into the blood vessels. Typically, that takes about 20 to 30 minutes to work, and will work anywhere from 4 to 6 hours, again, depending on the individual. In my particular case, sublingual drops last about 5 hours. You can also take capsules or edibles. These are the famous gummies, the lozenges and that type of thing. And you have to be extremely careful with this because they can take 30 minutes to 2 hours to work. We have kind of a saying in the industry, about the time you think it's not working and you take another one is the time it starts working. And this is where the famous stories of people that take the product and all of a sudden find out that they've taken a little bit too much of it and they get those negative side effects that come into play. Be careful. Be cool when you're doing orals themselves. It's very tempting to try another brownie, to try another cookie, to try another gummy. But be very careful because it's very easy to really get yourself into an uncomfortable situation. Topicals are very interesting in that they work right away, and there's two different types. That's those that go right on your body and go right into your skin, and those that actually penetrate the skin and get into your bloodstream. Now, in Mississippi, topicals are not covered by medical marijuana program. Topicals are sold on their own, but they are available. They are very, very effective, and I use them, for example, in my particular condition because I'm trying to manage herniated discs in my neck. I have 7 herniated discs in my neck from an auto accident, and this helps me tremendously. Last but not least is the famous inhalation method. Now, I've been in the medical cannabis business for a while, and a lot of people tell me, well, why do I need medical cannabis? I can just smoke a joint. Well, reality is that if you take that joint, you take that flower, roll it into a joint or a bud, and you put that up, you get ready to light this thing, and you take that 550-degree temperature, and you go to light that joint, what you're doing is you're burning off most of the cannabinoids, almost all of the terpenes, and almost all the flavonoids. You're reducing the medical efficacy of that joint or blunt down 50 to 60%. That's the bad news. The good news is it still is effective. In other words, you're maybe running this engine at about 40%, but it still provides some relief. If you would like to be able to take complete control or get full medical efficacy from flower, I recommend that you take a look at vape pens that you can purchase that have temperature settings, low, medium, and high. Most of the temperature settings that you'll want to use is low because that's where you get the bulk of the terpenes that come in and help you with things like pain, inflammation, anxiety, and stress. You can also use what they call concentrates. Concentrates are what they call, they may be called shattered, they may be called resin. I personally like concentrates because what you're able to do is take a concentrate pen, drop the product in there, again, set the temperature, low, medium, and high, and be able to get the full terpene effect from the cannabis flowers to be able to really help you with your medical condition. So again, inhalation is interesting. I'd recommend taking a look at vape pens and or flower, or concentrates, but there's nothing wrong with using flower. It is effective. You're just going to need more of it to be able to address your particular medical condition. So let's talk about how to get a card, a medical marijuana card in Mississippi. First of all, there's 3 different types of cards. There's the patient identification card, there's the non-residence card, and then there's a designated caregiver's card. The cost of the patient card is $25 if you're here in the state, $15 if you're a Medicaid user, and of course it's free of charge for disabled veterans and first responders. Non-resident medical marijuana card is a $75 fee, and again, you can get, if you're a Mississippi Medicaid care holder, it's a $15 card. I'm trying to figure out how to be a Medicaid user in Mississippi and be a non-resident, but we'll figure that out later. But more importantly, the designated caregiver card is $25, and in this particular case, they charge $37 because the state wants to do a criminal background check to make sure that you can be approved. Now, the time for the card, for the medical marijuana card, is 1 year. In the case of the non-residence card, you can get the card 3 times, and it's good for 15 days. In the case of the designated caregiver, again, it's good for 1 year, and you can only have 5 registered patients as a caregiver. Now, it's important to pay attention to the fact that to qualify, you've got to have a qualified medical condition designated by the state of Mississippi, and we'll talk about that in just a second. Also, if you are a disabled, you're going to use the disabled discounts. Make sure you have the Social Security disabled office card or a veterans card that shows that you're a disabled vet or disabled caregiver. What are the medical conditions? Well, there's a lot of them. I'm not going to go through each and every one of them, but a couple of them that are key. For example, seizures, chronic pain, cancer, Parkinson's, glaucoma. There's a number of different areas that really helps. If you're diabetic, you have diabetic neuropathy, I should say, PTS. There's a number of great conditions that really, I shouldn't say a number of difficult conditions that are addressed by medical cannabis and available here for treatment here in the state of Florida. Now, how do you get a card? First, the patient has to schedule a visit with a physician that has been approved by the state to be able to register people in the state registry. Bring your medical records when you go to visit that particular physician. What he does or she does is they determine if you in fact have that particular medical condition. Now, important is that if you do not qualify for a medical condition, you don't have to pay for that doctor's visit. So there's no harm and no foul by being able to go in and see if you qualify. And if you do, you can actually then go get a card. If the doctor does determine that you in fact have a qualifying condition, you then apply to the state to get a license. Just like you apply for a driver's license, you apply for a state license. And then you'll receive an email that'll tell you that you have your card. And then once you get that email, you can then print that out and you can then go to a dispensary, a licensed dispensary, and purchase product. Now, how does all that work? Well, for example, in my particular case, I'm a non-resident, so I applied for a card. I then got an email, and notice that in the email it says it's your responsibility to print the registration card. That is really important. You're not going to get a card from the state. You're going to get a capability in there in your particular portal to be able to download a PDF, download it and print it, and that'll actually give you that the card that's needed to be able to go to the dispensary and buy products legally. Now, what are some of the frequently asked questions? How long does it take to get a card? Well, typically it takes 10 days to get approval, and usually you get that card or that email within 5 days. I've been told that right now the state is trying to work on a program, and in certain cases, you can actually get that card number when you're actually at the doctor's office when you get the approval. Again, that depends on the timing of the doctor and where the state of Mississippi is at this particular time with respect to their technology in the background. Does the physician give you a prescription? They do not. In the case of medical cannabis, because there's different routes of administration and because every person's body is different, the state of Mississippi has it so that you have these things called MMCEUs. What is an MMCEU? Well, one MMCEU is either 3.5 grams of flour, 1 gram of concentrate, or 100 milligrams of THC that's in an infused product like a tincture drop. Now, what restrictions do you have? Patients cannot purchase, may purchase up to 6 MMCEU products per week, 24 per month, and they can have in their possession 28. Now, this is a bit complicated, and I know that that's something that's not very straightforward, but I think once you start using medical cannabis and you go to the dispensaries, they can help you figure out where you are in the whole program and exactly how much cannabis you can actually receive. Now, is there a state tax here in Mississippi? Yeah, the answer is yes. The state's not going to miss out on that opportunity. Can you use that card in other states? No, Mississippi doesn't have reciprocation rights with other states. In fact, most states don't reciprocate on medical marijuana cards. It's just something that the industry really hasn't evolved that much. There's only a few states that really do this, but it really helps to have that card with you, because in certain states like California, they will allow you to be able to take advantage of the benefits of that. What that means is you don't pay any sales tax if you have a Mississippi card in California and you go to buy product that's out there because they're a rec state. Now that's a 35% tax that you're avoiding. Is there a cap on the amount of THC in the products? And the answer is yes. Here in the state of Mississippi, flower, it cannot have more than 30% THC. Concentrates not more than 60%. Can I take cannabis across state lines? And the answer is no. This is a program just for the state of Mississippi. It's not something that I recommend taking across state lines. Again, it's very state-oriented, and I don't think you want to get in any trouble with any other states that's out there, especially if you're trying to travel with it, trying to fly, because the minute you go into an airport and you go into TSA, that's federal space, and it's federally illegal. So really, you can't use your medical cannabis here in the state of Mississippi. What happens if you're stopped by a law enforcement officer and you have the cannabis in your possession? They will verify that you have a card, and they'll let you go. So there will be a process where they will check. So keep that card with you and keep it available. Can I purchase a firearm from after being entered into the program? The answer is the state of Mississippi says yes. They have no problem with you doing that. In fact, here's the section of the act that approves that. That being said, the federal government, in their form, will ask you if you're using medical marijuana. And if you answer that question yes, there's a chance, in fact, there's a very good chance, that the federal government will not give you the approval to be able to purchase that firearm. So this is one of the reasons why we want to get medical cannabis approved nationally so that we get around a lot of these funky little restrictions. But again, you can purchase a firearm according to the state of Mississippi, and the feds right now are the only block that's really out there. Well, you need to get a background check to get a medical marijuana card? No. The only people that need to get a background check done our caregivers and practitioners. So where can you get a card? Well, I recommend going to True Relief, MD. They have 3 locations right now in D'Ibertyville, Jackson, and Oxford. And again, they're here to be able to help you not only get your card as a patient, but also as a designated caregiver. And by watching this particular video, use the coupon MMWW10 to get a 10% discount from them. I want to reiterate, the bottom line with medical cannabis is it's safe. You are in control and you'll not get addicted. And you don't necessarily need to smoke it. There are other ways of taking it, like gummies, like sublingual drops, that really can help you quite a bit. And I also want to point out that if you're interested in medical cannabis and you're interested in learning how medical cannabis can help you with various medical conditions, please go to our YouTube channel, Marijuana Aware. Then you'll be able to find not only YouTube videos on how to use it, for example, on the basics like this particular video, on dosing, on concentrates, on various routes of administration, but also it'll talk about how it works with anxiety and stress, pain management, cancer, a number of other conditions. So I thank you very much for watching this video and look forward to hearing your comments.